Hello, good afternoon. Dr. Trudy Ufundu of Snowspirations Global Health Solutions. Welcome to our weekend open clinic on YouTube. Today, we're going to look at the impact of dairy products on fertility. So that's what we're going to look at today. So please, once you come in, please let's know who you are, announce where you're located. Then, as soon as possible, we're going to talk about the impact or the effect, whether good or bad, on fertility regarding dairy products. So please make yourself comfortable and quickly settle in. We're going to talk about this topic. And after that, you will have an opportunity to ask your questions in real time. Okay? So get settled. I'm going to start as soon as possible. We're talking about dairy products and the likely effect dairy products will have on fertility. Is it going to be a good thing or is it going to hamper your ability to become pregnant? So, dairy products, of course, you know the meaning of dairy products. So, we're going to look at the effects of dairy products on your fertility. Is there a connection between using dairy products and fertility? Can use of dairy products predispose you to having infertility, or can it help you to have your babies faster? Now, I'm going to actually start. Once you come in, you join the conversation. After I'm done with my presentation, you will have opportunity to ask your questions. Now, generally, whenever we talk about dairy products, there's always a controversy, and it's very confusing because there are so many health organizations that promote dairy products as vital as regards your balanced diet, your well-being. However, there are also some health experts that tell you not to take dairy products. Now, the question is, who is correct? Now, thankfully, for the purpose of today's discussion, we're not going to go into the general discussion about use of dairy products on general health. We are going to narrow it down to conception. Now, remember, generally, for health purposes, whenever you're thinking about having a baby, you have to be mindful of your diet. A healthy fertility diet should constitute of fruits, vegetables, grains, proteins, and thankfully, your dairy products. Remember, when we talk about dairy products are any food made from milk of animals. Now, generally, the commonest animal we use the milk product is what? Cow. So for the purpose of today's discussion, we're going to focus on products that come from cow milk. So dairy products are mostly products that come from cow milk. So we're going to focus on cow-based dairy products. Now, what types of dairy products do we have? The commoner one is what? Milk. Milk is the most common dairy product that people use out there. This is the base form of dairy products. Now, you can have cream, you can have butter, you can have cheese, then you can have yogurt. These are all products that come from your dairy products. Now, generally, regardless of the form or the amount of dairy products you're consuming, be it butter, be it cheese, be it yogurt, be it milk or cream, it's important you consume it in the quantity and the form that will help you. Once you begin to manipulate the content of the dairy products as regards the calcium content and especially the fat content, this is where we need to be very, very careful. Now, talking about the effect of dairy products on reproductive health, what's the right thing? Now, generally, what I'm going to tell you now, it's what we know as of today, because there's a lot of controversies out there. Now, generally, please, if you are intending to be a mother, if you are intending to be a father, and somewhere along the line, it's been difficult to conceive, please, when you are using your dairy product, please, you should avoid, first and foremost, low fat or no fat dairy products. So it's important you understand this point. You see, it's very easy for people to go out there to buy dairy product, to buy milk. Then we look for what? Low fat or no fat dairy products. Now, for the purpose of conception, that's not advisable. So you should avoid low fat dairy products. Avoid them. Don't use them. If you are planning to become pregnant, if you are already having infertility, you need to consume products. You need to consume your milk. You need to consume your yogurt. You need to consume your butter and all that. The ones that have fat. Fats have a role they play in your body, especially if you are having ovulatory infertility. So based on a current research from Harvard, Harvard is a renowned medical school, a renowned research institution. They discovered that women that consume low-fat dairy products will normally have risk factor as regards ovulatory problems. So in fact, they discovered that women that eat or have 2 or more serving of low-fat dairy products per day have about 85% risk of having ovulatory problems. So by default, make conscious effort. If you're going to take your milk that has fat. Don't go for half fat or no fat. When you're depriving that milk, when you're depriving the butter, when you're depriving yogurt of the fat component, you are actually flipping the balance. Remember the 2 important hormones that will help you to become pregnant and stay pregnant. What's the 2 important hormones? Your estrogen and progesterone. When you are consuming your milk, when you are consuming your yogurt, when you are consuming your butter, when you are consuming your cheese and you remove the fat component, when you're removing that fat component, you are principally removing the estrogen and the progesterone binder in the fat molecule. And when this happens, you begin to flip your hormones. Now, unfortunately, anytime you disrupt estrogen or progesterone in the body, you are flipping the whole equation to favor testosterone. Testosterone are the androgen hormones. These are the hormones we want more in the men. So when you don't have adequate level of estrogen and progesterone, your body will begin to produce more testosterone, which on the long run will lead to more fertility problems. So women that have more androgens, women that have more testosterone compared to the level they should have will likely not ovulate. So it's important to understand that this particular study only looked at ovulatory infertility. There are also so many other forms of infertility, but specifically as it relates to ovulation, women that avoid taking fat content in their dairy products will struggle with ovulating. So please, if you have to take your milk, take your fat containing milk. Don't go for those half this, half that. Just take your milk, but make sure moderation is key. Make sure the milk is pasteurized. Of course, make sure you balance all the other 5 components of the food which you need. This is very important. Matter of fact, when we have this research, we are so excited, but we haven't really checked the impact of low-fat dairy products on diminished ovarian reserve, recurrent pregnancy loss, PCOS, and other infertility issues. But we know that women that consume no-fat or low-fat dairy products will struggle in regards to ovulation. And you know that ovulation is at the center of everything. Now, there are also some claims out there against full-fat dairy products. Now, as of today, there is no solid research study that came out categorically and said, hey, don't consume fat at all. So don't deprive yourself of milk. Still use your milk, still use your butter, still use your yogurt, and make sure they contain some fats because you need them. Now, unfortunately, based on the environment we are living in now, the way they prepare those dairy products is very important. Unfortunately, in some situations, in course of preparing your butter, your cheese, your milk, they might use some chemicals we call endocrine disrupting chemicals. These are the chemicals they can use to preserve all these dairy products. And in course of doing that, they will introduce artificial hormones that will go and disrupt the hormones you have already in your body. So if we have endocrine disrupting chemicals in the milk, in butter, in cheese, in yogurt, they will go and flip your body and your hormones will not balance. Now, also, there's a particular product we normally see in dairy product. It's called casein protein. We've also noticed that this casein protein might support inflammatory and immune sensitivity in some individuals. So please, my final word on this. Personally, I will not tell you to avoid any food item. Avoiding any food item is actually depriving yourself of what you need. Moderation is key. So if you have to use your milk, use full milk. Don't go for all those modified milk. I'm talking about women that want to become pregnant. I'm talking about men that want to become pregnant. If you don't want to become pregnant, if you don't want to be a father, if you don't want to be a mother, that's entirely different. But as of today, anytime we talk about dairy products, like I told you guys, it's very controversial. But please, moderation is key. As of today, avoid consuming low-fat dairy product or no fat at all or low fat. Consume them, but be mindful of your fruits. Be mindful of your vegetables. Be mindful of your protein. Definitely drink a lot of water. And of course, you need your carbohydrates. So these are all the things you should be conversant with while you're pursuing to become pregnant and become a mother in 2023. Okay, so that's my presentation. And right now, I'm going to give you an opportunity to ask your questions in real time. So the clinic is going to open now. I can see the group COO, amazing lady. Thank you so much for coming, Kenneth. And I can also see Tosi, amazing lady too. So both of you are welcome to today's open clinic. Please settle in and start asking your questions. The clinic is open now for questions, please. Go ahead and ask your questions. Do you have any questions? COO, do you have any specific question? I know you always have something to ask. Sometimes YouTube will allow the questions. Sometimes the questions will be hanging. But please go ahead and ask your questions if you have any question to ask. And I'll provide you feedback. Okay? Does dairy affect sperm? So here's the deal from what we know. The research we've conducted so far, it's mainly in regards to ovulation. So that Harvard research I mentioned, they actually look at dairy products and ovulatory problems. But this is what we also know. Let's be logical about it. The problem that males will have in regards to their fertility is mainly in regards to testosterone and the function of the sperm. Now, since we might likely have an imbalance or balance between the fat component in the milk or butter or anything that contains dairy for women. By extension, it can also affect men. But there is no study that came out categorically and said, oh, take this type of milk or don't take that type of milk as it relates to the men. But this is what you should know. Whenever you're eating anything, be mindful of the calorie content. The reason why some men might struggle to impregnate their partners, the reason why some men might be having poor quality sperm is because of their lifestyle. So when you begin to add a lot of body weight, when you're stressing, when you're not exercising, when you have hypertension, when you have diabetes, when you have a lot of stressors in your body, the possibility your eating habit will be messed up is very high. Now, there are so many things we do out there that contain very high level of calorie. So if you're a man and you love taking butter, you love yogurt, you love milk, you love cheese, and you do them beyond normal reasoning. You see, when you want to eat, you don't go start eating milk or butter or cheese or yogurt as if your life depends on it. Moderation is key. But as of today, we do not have any literature that supports any claim for or against regarding dairy products and male fertility. I love that question, Kenny. Okay? All right. Is it true that women with fibroids should avoid dairy products? There is no rationale for that. There is no evidence in support of that. Okay? Right now, most of the things we know about fibroid are anecdotal. Like today, nobody knows exactly what causes fibroid. We only know about the risk factors. So there is no plus or minus as it regards use of dairy products when you have fibroid, or if you use it, whether it's going to cause fibroid. There is no direct association between your dairy products and your fibroid. Okay? But this is what we know. The more healthy you are, the more healthy your body weight is, the lesser stress you have, the better food you eat, the more you might likely, you wouldn't even know you have fibroid. Some of you might even have a quiescent fibroid in your body and you wouldn't know. But women that have excessive body weight, women that have stress, women that pretty much have a lot of things going on in their life, the fibroid that might just be tiny in your body might suddenly start misbehaving. But we don't know now what leads to fibroid. It's still unknown. Okay? All right. Please keep asking your questions. I'm loving the questions. Shortly after this, we're going to go to our we're going to go to our Facebook page to run an open clinic for the weekend, and we continue our conversation. So you can join us on our Facebook page after this, and we continue our conversation. But right now, once you come in, remember to subscribe to this community. We normally show up every Tuesdays and Saturdays. Every Tuesdays, 6:30 p.m. Eastern Time, which is equivalent to 11:30 p.m. Nigerian time. Weekends, we normally show up by 12 p.m. Eastern Time, 5 p.m. Nigerian time. But today, I had a lot of engagement, so I couldn't come forth then, and I had to come in by 4:30. Okay? But guys, once you come in, make sure you subscribe. Make sure you set your notification so that anytime I come live, they will inform you. You will join me and I will give you your feedbacks. Okay. Is it true? Okay, good afternoon, Doc. You came in late. Please, can you go over the dairy products and the food you should eat? Now, the contention today is if consumption of dairy products. Remember, dairy products are the milk are products that come from the milk of animal. And today we are focusing on cows. Majority of the milk we use comes from cow, okay? So there are products that come from milk from cow. You can have the direct milk, you can have cream, you can have yogurt, you can have butter. Any of this, you can have cheese. Any of this is a dairy product. Now the contention is, when you consume these dairy products, are they gonna help you or harm you? Especially as it regards the fat content. And we discover through a recent research by Harvard College that women that consume low fat or no fat milk or dairy product will struggle with their ovulation. So we do not recommend you going to a supermarket and buying a milk, a butter, a cheese that probably has half or no fat. You need your fat. There is a reason why God gave you the fats, because fats are part of the things that will help your ovulation. So when you don't take them, you're depriving yourself of estrogen and progesterone, of which if you don't have them within a normal range, you will not ovulate. And when you don't ovulate, you will not become pregnant. Okay? What's the difference between organic and regular dairy products? Now, I want you to actually use processed. So organic means the raw form of dairy products. So using an example for the cow, organic means directly they went to a cow, they milked the cow, and you're consuming the milk directly. The only thing they will do to the milk is to pasteurize the milk, right? Now, the other flip side is highly processed milk. So there are so many people that take inorganic milk, so they must have passed the milk through a couple of processes, use some preservatives and do all that. Now, by the time they're doing this, they are depriving that milk or the dairy product of its natural component. So anywhere you see organic means directly from the source. Inorganic means going through a couple of processes behind the scenes. Like, guys, if you don't know, there are so many people that use antibiotics to grow some chicken, meat, to prepare so many things we consume. And most of those things we are consume on a daily basis, some of them might not be good to our health. We might not know now until much later. There are so many things we eat on a daily basis that might have cancer-causing chemicals. There are so many things we might pay from the supermarket because it's very convenient. There are so many things they use in preparing our food that might be carcinogenic. So the one you prepare for yourself is better. The vegetable, the fruits you can harvest from your farm is safer compared to the fruits you can buy anywhere. Why? Because there are so many chemicals they use lately. Some of them might come in form of, insecticide, pesticide, fertilizers, and all that, or preservatives. So by the time you're consuming stuff you get from, supermarket and all that, you're consuming the chemicals. And some women don't do well with chemicals. There are some women that the chemicals don't do anything in their system, but there are some women that will begin to have infertility problem or even begin to develop cancer based on where they're buying their food. So it's always advisable to be the person preparing your food. Very important. You see, there is this saying about fast food. Fast food will tend to kill you faster compared to the food you prepare for yourself. I'm not saying, 24 hours, 365 days in the year, you stay back and you're preparing your food. It's not possible. Let's tell ourselves the truth. There are sometimes everybody in the family will be busy. You need to be on the go. You need to buy McDonald's. You need to buy China. But don't do it every time. Anytime you have an opportunity, prepare your meal. Prepare the meal that your kids are going to use. Prepare the meal that your spouses will eat. You are better off, knowing what you're preparing and knowing the quantity of what you're using in preparing your food. Okay? I love that question. Okay, guys, ask your questions, please. Ask your questions. Remember, today we are looking at dairy products, and there are different types of dairy products. You have the milk, you have the yogurt, you have the cheese, you have the cream, and what again? Yogurt, cheese, cream, milk. They are all products from animal milk. So there are so many things we can do. We get butter. There are so many things we can do. We get cheese. There are so many things we can do. We get yogurt. They are all products that come from the milk of cow, especially. Okay, guys, do you still have any questions? Ask your questions. Remember to join me immediately after this in our Facebook page. I'm going to go live in our Facebook page, spend about 30 minutes after this, and we keep the conversation ongoing. Okay. Remember to subscribe. Remember to check your notifications and make sure you're notified anytime I come live. Check previous videos. Share this channel with your friends. Tell them we have a lot of good things for them. Invite everybody in your community, especially if they are having infertility problems. Make sure they belong to all our portals: Instagram, TikTok, groups, pages, YouTube, even our website. Make efforts to go through all this. There are so many things that will benefit you in this group. So many there. All right. So if we don't have any other question, and COO, give me a signal so we can go and prepare for the next clinic. But thank you so much for coming this evening. I appreciate you spending your time. So please, if you're believing God for a baby, we don't try in our group. Keep on eating the right kind of stuff. Remember the 5 classes of food you need to eat: your fruits, your vegetables, your protein. Improve your chances of becoming a mother. Okay, do you think hormones in the milk can affect those with hormone imbalance? 100%. Yes, I think so. Remember, I just told you a story about progesterone and estrogen. So unfortunately, when we begin to consume so many things out there are some chemicals they use in preserving milk so that it won't expire on time. There are some chemicals they use in putting all those combo, because if you go out there, they will tell you skim milk, almond this, almond that. So sometimes the products they use in preserving all this might be hormone disruptive. So what's hormone disruptors? There are chemicals out there that find their way into the food we eat. When they get into our body, they begin to cause hormone imbalance. So the answer is yes. There are likelihood that some components of the milk might actually go into the body of a woman and disrupt her natural cycle, menstrual cycle, disrupt your hormone. Anytime you have problems with estrogen, anytime you have problems with progesterone, your body is not going to function properly. So higher, lower estrogen, higher, lower progesterone will definitely affect your fertility. So thankfully, if we identify this on time, we can correct them, then you can have an opportunity of becoming a mother. So the answer is yes. Okay? What's the difference between traditional surrogacy and gestational surrogacy? Is it true that when you go through IVF, you will give birth through CS? Now, your questions are a whole lot, and you kind of mixed a lot of things up. I can see you putting IUI in bracket. IUI is not traditional surrogacy. I'm going to explain the difference between traditional surrogacy and gestational surrogacy. So surrogacy means, for some reasons, your womb as a woman cannot nurture and carry your baby for some reasons. There are so many reasons. So what do? We look for a surrogate mother. Okay? Now, a surrogate mother is the lady that will eventually carry your baby. Now, there are two different ways of going about this. If your eggs are okay and your partner's sperm is okay, the only role that woman will play is what? Traditional carrying your baby. So that's the only role. You bring your egg, we bring your partner's sperm, we join them together, they form an embryo, we transfer them into the surrogate. Everything about that baby, it's between you and your partner. The only role that the surrogate woman will play is to carry the baby. Now, on the flip side, sometimes the surrogate mother herself will be the person who will use her eggs to perform this process. So that's a big difference, traditional and gestational. So depending on how you present, depending on your unique situation, unfortunately, if you're a woman and we check your ovarian reserve, so your ovarian reserve is a test we will run to know if you still have eggs. Ovarian reserve is looking at quantity of eggs. So assuming you're 47 and you want to start your family, but we run your ovarian reserve test and your AMH is practically zero. What's the interpretation of low AMH or zero AMH? It means you no longer have eggs. It means you're warming up to go into menopause, or you're premenopausal, or you're perimenopausal. So what happens? You no longer have eggs. What happens when you no longer have eggs? You cannot participate in the process of pregnancy. What do you need? Donor egg. So in that situation, if you are going for surrogacy, but we discover you do not have eggs, it's not going to be traditional surrogacy. It's not going to be gestational surrogacy, because we're going to look for a donor who we're going to use the donor's egg, then use your partner's sperm, then get it to embryo phase, then transfer it to your other woman. So it's a complicated thing. But people, you see, the process of having a baby sometimes can be so complicated. So that's why you don't need to wait till it gets so complicated. You need to act on time. There are some women that can complete their family without even needing IUI, without even needing IVF. But by the time you are ready, the only option left for you might be IVF. And you might not be receptive to IVF. You see, the mind is a terrible tool. If you are going for IVF reluctantly because you heard or because they convinced you and you just want to go for it, guess what? Your mind will also participate reluctantly. But if you're going for IVF with a determined mind, with a faithful mind, with a product of God, with knowing fully whether you're going to become, then your mind will play along with you. There are so many women that want to become pregnant, but they are not positive about wanting to become pregnant. They are coming up with negative mindset, but you can't use negative mindset to have something positive. So the best time to go for your IVF, if IVF is your route of becoming a mother, is now. Don't delay, because by the time you're ready, please, admin, you can put this in words. By the time you're ready, my sister, you might come back, you no longer have eggs. And remember, we from the African part of the world, we have problems with accepting our reality. So some women ordinarily might find it difficult to even go for fertility treatment. Some women ordinarily might have fought with their partner before they agreed to go for IVF. So consider this. Suddenly, you no longer have eggs. You begin to have another family meeting of using donor egg, of using donor sperm. So the possibility that an average Nigerian will quickly jump into donor egg or donor sperm, it's difficult. There are some couples that will prefer not to have babies than to go and use donor. But that's not a wise decision. I was consulting a lady today, And her biggest worry wasn't even that the problem is that they don't have a baby. The problem is how to tell the partner that the problem is coming from his sperm, but something can be done. So some women are afraid to even divulge to their male partners that the problem is coming from them. But my brother, if you don't have sperm and you want to have your family, there is no magic. This is a family meeting you need to understand. There are so many things you need to come to reality with. It might be tough, but you need to do it, because if you don't do it, you're delaying. Very important. After myomectomy surgery, can one give birth normally? Now, I need to correct that impression of, feeling that vaginal delivery is normal, then CS delivery is abnormal. CS delivery is not abnormal, it's normal. And the answer is yes. You can have CS and in your previous pregnancy, then you can go back and have vaginal delivery. It depends on the progress of that pregnancy. It depends on the reason why you had that CS in the first place, and it depends on your general health. So yes, some women can have CS in the past, and subsequently in their pregnancy, they can deliver their baby through the vagina. It's called VBAC, vaginal birth after CS. Correct. Admin is actually making it very, very simple. If IVF is your only option to pregnancy, please don't delay. Your ovarian reserve diminishes with age. Let me explain it. Maybe you understand it better. You see, when you have ovarian reserve that is depleted, it means you see these colored dots. These are your eggs. As you're aging, every month you'll be losing them. You'll be losing them. Now, time will come when we go in, we see only few. This is what happens. There is no other place to manufacture egg in your body. Once you lose them, you've lost them. So act as soon as possible. Okay, my time is up. Thank you for coming. Please transition to our Facebook page. Right about now, I'm going to switch and we're going to continue the conversation. Thank you for coming this weekend. Always remember to have family time, have your kids' time, your spouse time. Spend time and know what's going on in your family within the weekend. Okay? Thank you so much for coming. I'll see you guys again on Tuesday. Until I see you, God bless you and enjoy your evening for now. Bye-bye for now.